Hello, my name is Odelia Mirzadeh and I'm the co-founder of Innovative Speech and Language Pathology. Today I will be discussing how to do facial exercises for stroke patients. Stroke refers to the interruption of blood supply to the brain. The stroke symptoms have to do with what region of the brain has been damaged and therefore the associated nerves controlling each muscle group. It is important to find out which muscle groups are affected because it would directly affect the patient with their speech production and their swallowing. If they have a weak jaw, then they will not be able to chew their food correctly, which will cause them to perhaps aspirate and have pneumonia thereafter. If they're drooling, if their lips are not as strong and they have lost their strength, then they will be drooling a lot. And again, they can have drooling of food aside from their saliva. And if their tongue is affected, again, it affects their swallowing because it helps with their chewing and propelling the food, the bolus, back into their throat and helps with swallowing directly. Therefore, it is very crucial to know what muscle structures have been affected, not only for their swallowing, but rather for their speech production. If their jaw is not working as accurately, then their speech can be muffled, or they can have a very difficult to understand speech. If their lips aren't working as effectively, if they can't round their lips, or if they can't have effective labial closure, their speech sounds will be affected, as in the words such as one or wonder or mother or back and so forth. If their tongue is affected, the sounds that affect the tongue, such as the front producing sounds such as the t sound or the d or the n sound will be affected, or even the s and the sh sounds, or the further back sounds such as the k and the g or the ng, as in ring, will be affected. It is important to do facial exercises with these clients to help them restore or help with the strengthening of the muscle groups to help them with their swallowing as well as their speech production. Some tools that may be used may be facial massages, or the use of horns, the use of straw drinking, the use of bubble blowing, and the use of bite blocks to help with jaw grating, as well as other methods to help with placement and the direct touch of each muscle group and the sounds. It is very important for the patient with stroke to see a speech and language pathologist after being seen by a physician to help and assist them with their swallowing as well as their speech production. And that's why the methods and exercises for oral motor structures and facial tightening exercises come in handy.